Hi, thank you so much for participating in the Wellness Wave brought to you by ACP Southern California Region 3. My name is Alex Malouf, and I'm so honored to present to you Dr. Jess Mandel. Hi, Dr. Mandel. Thank you so much for taking the time to speak with us. How are you doing today?
Well, thank you. Thank you so much for this opportunity.
Please tell our audience a little bit about yourself and what you do.
Sure. So I originally grew up in Chicago. I have lived in a couple of different places for training and jobs. I went to college at Brown University in Rhode Island, medical school at Baylor in Houston, did my residency and fellowship training in Boston, joined the faculty at Beth Israel Hospital there as well. Then was at the University of Iowa for about 5 years and have been at UCSD since 2006. And currently I serve as Chief of Pulmonary and Critical Care Medicine and as Vice Chair for Education in the Department of Medicine.
Thank you so much for sharing. And can you tell us, how did you choose your career path in medicine?
Well, there was certainly not a master plan where I figured it all out. I'm the only physician in the family, so I didn't have a lot of either family role models or family pressure to go in any particular direction. And I think when I did my rotations as a medical student, internal medicine just really resonated with me. I thought there was the incredible diversity of patients and patient problems that I enjoyed. I really liked the opportunity to have really meaningful relationships with the patients as well. And I thought the colleagues were fantastic, that people in internal medicine were as intellectually curious and as excited about things as I was. And I just thought the level of professionalism and sort of devotion to the craft was really inspiring as well. And then in residency, sort of figuring out to subspecialize, I think one of the things I wrestled with was wanting to keep that broad internal medicine knowledge, but also go deeper in something as well. And pulmonary and critical care medicine, I just think, is a great combination of those things. In some ways, you're very, very deep, particularly on the pulmonary side, but the critical care side really forces you to remain very broad as well, and take care of a diabetic ketoacidosis next to a drug overdose, next to a respiratory failure, and sort of keep all of that knowledge sort of working at once.
Well, it's incredible everything that you do. And it's important that you brought up being intellectually curious, and that kind of also led you to the path of internal medicine and pulmonary critical care. Some of us, though, we're still trying to figure it out, be it medical students and residents. Do you mind sharing with us what advice do you give for them as they're trying to figure out their career path in medicine?
Yeah, I think things work best in life when there's alignment with what you really enjoy doing and what you are doing. So I think the most important thing is to look for what brings you joy and what brings you the rewards that are most important to you. And, there's a lot of different types of rewards in medicine. The sort of rewards from doing a technical procedure really well, the rewards of really working, over months and years with patients longitudinally, all sorts of different rewards. And I think each of us have a slightly different combination that's optimal. But I think really figuring out what that is and then doing it is the key. Because I think the way people are great at their job is that they really are excited about it. They're really passionate about it. I think medical students and residents are all super smart. So there's a bit of a risk there, in that people can be good enough at a lot of different things, but they need to find the thing that they're really excited about, and that's what they'll be great at and take the most joy from.
Transitioning now to our wellness questions, I wanted to ask you about, how do you deal with stress in the ICU? And I know I was so blessed to be able to shadow you as a first-year medical student in the ICU. And I saw how you handled everything with so much ease and peace, and encouraging your residents and helping your residents through some difficult times. So just on a general note, how do you deal with stress, like in ICU and in other settings?
Well, there's no doubt about it that the ICU can be a stressful situation at times, but I think we have a huge advantage in that it is, I think, the most team-oriented team sport in medicine, that you're never there alone. You always have terrific colleagues, not only at the physician level, but also among nurses, respiratory therapists, really everyone in the unit. And I think it's super important to really get to know all of those people and to really have those relationships, because I think we help each other. When one is down, another is up, and that positivity and that enthusiasm, I think, helps us when we need it. So altogether, I think just being part of that team effort and really working hard every day to do good things for our patients and be there for each other really carries us all along.
With regards to COVID, and now that in the pandemic, we have residents and medical students in training, I just wonder if you have any points to share with our audience. I know you here at UCSD led a big initiative against COVID, and even going to across the border to help in the peak of COVID. So thank you for doing that.
Oh, sure. It's been, I think, quite the experience for everyone, and not just physicians and not just pulmonary and critical care folks, but there's no one in the world who hasn't been touched and affected profoundly by COVID. I think the lesson that I've learned, I think, most during COVID is that ordinary people can do extraordinary things when those things need to be done. And so it's very inspiring to see that. And I see elements of that every day that I go to work.
Last question we have for you is regard to if you have a wellness phrase or quote that you would like to share.
Sure. I would say that the phrase I would go with is the best way to accomplish change is to try. And I think a lot of times the tasks before us seem so great, we kind of talk ourselves out of trying a little bit. And that's true of things we see in the hospital that we think can be done a little bit better, but also true sometimes in our own life if there are changes that we need to make. And every change I have seen in the hospital, every change I've seen, in our own personal lives has been because someone decided, let's try and do better in some way. I think it's important not to accept the status quo. That's true in our professional life, but true in terms of our wellness as well.
Thank you so much for sharing your knowledge with us today. Our viewers will most definitely benefit from the advice you shared. Thank you.
Thank you, Alex.